Hello people, in this video let us look at bezoars. Bezoars, these are non-digestible materials. Okay, usually they'll have vegetable origin, that is phytobezoar, that is from plant you can say. But if they have hair, that is trichobezoar. So basically bezoar is what? Non-digestible material. So if you eat it, what will happen? Obviously it will go and sit in the stomach, right? So imagine if this is your stomach and you're eating some non-digestible stuff. Okay, so here we are trying to draw your stomach, and for some instance these people have eaten hair. Now the hair is going to sit here. It's going to form this kind of stomach. It's going to take the cast of the stomach, and imagine it will be here somewhere. It'll keep moving and it will have this cast. It will take the shape of the stomach, let us say. Okay, so this is trichobezoar. So non-digestible material, if it is of vegetable origin, it is phytobezoar, but if it is because of hair, then it is trichobezoar. Imagine in children you have something very similar called as pica. So what is pica? Pica is eating of non-nutritive substances. Okay, so pica is eating of non-nutritive substances. Here you are talking about non-digestible substances, bezoar. Okay, here you are talking about non-digestible substance. There you were talking about non-nutritive substances. Okay, so pica, they can eat soil, gum, paper and all that. So that becomes pica. Bezoar is non-digestible, like hair. Okay, hair is not digestible. So these patients will be women who have long hair and they deny eating their hair, but you can find some patches of alopecia probably in them. Okay, they are doing trichophagy. They are eating this non-digestible material. So here you can see how the hair has taken the shape of stomach. Okay, so appreciate the shape of the stomach and first part of the duodenum. This is how the bezoars are. So these people would have undergone surgery of the stomach and they'll have impaired gastric emptying. Okay, so this is actually found in patients who have undergone surgery of the stomach. That means they've already undergone a surgery of the stomach, is it? And diabetics with autonomic neuropathy are also at risk for this. So why are they eating it? Interesting, right? Anyways, so how will the clinical features be? They will have early satiety. So even if they eat little, they will feel full, which is actually interesting, right? Instead of doing all that gastric bypass surgeries and all that, they can actually do this type of, ask them to eat hair which will block the stomach and they will feel full. Interesting. No, we are not suggesting anything. Weight loss, nausea, pain, vomiting can be there because of gastric outlet obstruction. This can lead to gastric perforation and small bowel obstruction. This we don't like. Perforation and all, we don't like it all. Don't worry. Okay. So basically there is an obstruction and then there can be perforation, etc. A large mass may be palpable on physical examination. So when you press on these people's stomach, abdomen, you can feel a large mass. And if you give them barium and then you examine, you can confirm it by a barium examination, or if you also can do an endoscopy and confirm. Okay, this is the investigation that you can do for these people. What are the investigations that you can do for these people? The investigations that we can do are abdominal examination. You can do, you can feel a large mass, you can do a barium examination, barium meal or barium something like that, you can check. Then there will be obstruction, you can do endoscopy, right? And then you can take history and ask them clear cut, do you eat hair? They may say yes. If they say yes, okay, ask them alone. If they are in front of others, they may not say. Anyways, what is the treatment? You have to give it give something so that you can dissolve it, so that you can digest it. Not digest exactly, but you can dissolve it, kind of a thing. So there's a lot of hair here. You want to remove it. So how will you remove it? You just give it some enzyme. The enzyme therapy. So which is the enzyme that you are giving here? That is called as papain. Papain, if you give P-A-P-A-I. This name is strange, right? It has pain in the name. Okay, papain is the treatment. Okay, papain is the enzyme which will dissolve this hair. This is enzyme therapy. So papain, where do you find it? In Adolph Meat Tenderizer. Okay, Meat tenderizer, they will use this, looks like. So papain they are taking and giving it with water. Sodium concentration in AMT is high, so hypernatremia may occur. So you should be careful about this because papain will have more sodium. Okay. So did you get it? Papain you are giving, it is found in some meat tenderizer, and it may have sodium, so it may cause hypernatremia. So you should be careful. Okay. Then cellulase you are giving. Cellulase is what, guys? Again an enzyme only, you can know. Cellulase to dissolve this hair. Right? Then aggressive Ewald tube lavage. Look at this, aggressive Ewald tube lavage or endoscopic fragmentation. So you can do tube lavage or endoscopic fragmentation. So you are going endoscopically and fragmenting this huge mass. Finally, if nothing works, you can just do a surgical removal. So if you don't want to undergo a surgery where they cut and blow that, endoscopically they can go try to fragment it, give that person some enzymes like cellulase, papain, so that they can dissolve it. Okay. In some people, this mass can even be there in the transverse colon, right? So like that only if it comes out, it can come out of the anus, right? But here the textbook says, so far they have observed it as far as the transverse colon. Just little more if it comes out, it can come out itself, right? That will be nice. But anyways, they are trying to dissolve and trying to remove it, fragment it and remove it, etc. In this video, you have understood this terminology, bezoar.